Hello viewers, this is Dr. Hiya Agarwal, fertility consultant at Neelkanth IVF, Jaipur. We have a common question among people who ask, can men be infertile? Can there be any reason when the men are not able to produce babies? This is a job of females and it is a big myth, and we as a fertility consultant are appalled at these questions when the people ask ki, how is my son or how is my husband not infertile? What is the problem? How can that happen? He is able to have contact with me, he is healthy, he looks good, what is the problem? So it is a basic unawareness in our population, in our Indian population specifically. Because of that, the people think the men cannot be infertile, which is a big lie, a big false. Men produce sperms in their semen sample, and once when they intimately have a sexual contact with the female, they deposit that sperms in their vagina, and with that the sperms travel through the uterus and go into the fallopian tube. If these sperms go into the fallopian tube during the time of ovulation, they fertilize the egg and form an embryo, and these embryo then gets implanted into the uterus of the female partner, and hence the pregnancy is conceived. So with this, we understand that male sperms play a a pivotal role in having a baby. If those sperm count is not adequate in the semen sample, then it will not be able to fertilize the egg. There are lots and lots of sperm released in the semen sample and only one fertilize the egg. Then what is the problem if even the count is less? So the problem is that there is lot of redundancy. That is, lot of sperms die during this process because the female body has lot of harsh chemicals towards it. So they need to have a very good number of counts. They need to have a good motility for them, for just the one sperm to go and fertilize the egg. That's why WHO has developed certain parameters how to see whether the males are fertile or not. So for this, we usually ask the male partner to provide the semen sample. In the semen sample, the basic things which are seen are the count of the sperms, what is their motility, how are they looking, which is called as morphology, which play a very pivotal role in their fertility potential. So according to WHO, if the count of the sperms is less than 15 million per ml, then the chances of having a normal conception decreases. If the count is between 10 to 15 ml, then we usually prescribe them fertility treatment of intrauterine insemination. In that, we process the male sperms and we inject directly into the uterus of the female partner. How does it help? Because in this process, we decrease the pathway which the sperms has to travel. Along with it, we introduce the best quality and the best motility sperms into the uterus. Hence, the chances of pregnancy improves. But the pregnancy happens through the natural ways. The fertilization occurs in the tube. When the count is less than 10 million, then the IUI is not usually successful. Then the patients are recommended the treatment of IVF. In this process, we stimulate the female partner for multiple egg formation, and we take the eggs out, and you take the sample from the semen, sperms from the semen sample of the male partner, and fertilize them in the lab. When we are fertilizing the sample eggs in the lab, then the amount and the number and the motility of the sperms are not required to that much level. So the decreased sperm count can also produce good embryos and these male partners can become fathers. If the count is less than 5 million, then also we have an advanced technique called as ICSI, or intracytoplasmic sperm injection, in which the individual sperm is taken and put into the egg so that it fertilizes. That also produces good embryos and can help countless male partners to become fathers with their own sperms. Even if there is no sperm in the sample, then also we can introduce a needle in the testis and take out those sperms, and these sperms can be introduced into the egg of the female partner with the help of ICSI. So the males who are suffering from the decreased sperm count, decreased motility, are advised to first visit a fertility consultant, and they can have a good diet which is rich in oranges and almonds, so that their antioxidants are increased and they can improve their count. If the count is very less, then the medical treatment can be given. If medical treatment also fails, then these assisted reproductive technology techniques like IUI, IVF, ICSI can be done. So, the male partners, you have to be awakened and being aware that there is a fertility issue. Getting treatment for your female partner again and again will not result in success. Accept the reality, there are treatments available and it will help you in getting a baby. So, for consult a fertility physician if you are suffering from a low sperm count and take the treatment accordingly. If there are any queries regarding the same, you can contact the below number or you can visit our center. Thank you.